Hello, I'm Dawn Jennifer and I'm here to briefly explore the untold accounts of the women and girls who were admitted to the lying-in department in Adelaide, South Australia for midwifery and maternity care between 1880 and 1918. In May 1878, Adelaide's newly constructed lying-in department building, which formed part of the destitute asylum complex, opened its doors. Under the control and management of the Destitute Board, the new facility provided public maternity care for destitute pregnant women. The aims of the lying-in department were to assist destitute women before, during and after childbirth, to ensure the natural nursing of the infant by its mother, and to preserve the mother from a further lapse into immorality. Nearly 850 women and girls were admitted at least once for lying-in relief between 1880 and 1918. Ranging in age from 13 to 49 years at first admittance, it wasn't unusual for a woman to be admitted for 2 or more births. Abigail, a single woman, had 7 children at the destitute asylum between 1894 and 1908. Most women were aged between 15 and 24. 10 of the admissions were aged 14 or under. The majority of women were single. Of the married women, most were either widowed or deserted wives. A handful had husbands who were unemployed. Most women were resident in the colony of South Australia, and despite the chair of the Destitute Board claiming in 1880 that the institution is known all over the colony, as well as in Queensland and Western Australia, as being a very comfortable lying-in hospital, only a minority travelled from outside South Australia. 3/4 of the women were employed in domestic and general service. As in other colonies, domestic service was the leading form of employment for working class women at the time. In many cases they had been engaged as live-in domestic servants at the time of conception and had consequently lost their accommodation along with their positions. With the loss of employment and accommodation, the women lacked the money to pay for a nurse or midwife in independent practice for confinement at a private address. An earlier adopter of qualified experienced midwifery, the lying-in department employed certificated midwives in the role of matron from as early as 1880. The midwife only sent for the destitute asylum's medical officer in cases that required instrumental delivery, such as forceps, or where there was a prolonged labour. From 1907, the matron's assistant was also a qualified midwife. Women were admitted at different stages of their pregnancy at any time of the day or night. Often they were admitted 2 or 3 months ahead of their expected confinement date. Some arrived already in labour. A minority entered with their infants having given birth elsewhere. Ethel, 22, who had been employed as a general servant at a hotel in Port Adelaide, gave birth to an illegitimate male child in the waiting room at the Port Adelaide railway station 4 days prior to admittance to the destitute asylum. Upon arrival, every applicant, their personal circumstances and family background, and the reasons for their destitution were personally investigated by the chairman of the Destitute Board, unless he was absent, to decide whether she should be admitted and how she would be categorised. Women were classified and segregated into 3 groups. Married women, or first-time fallen, were accommodated in the lying-in department. Women fallen a second time or more were housed in the general women's ward of the Destitute Asylum. Prostitutes, or women of doubtful character, were placed in the ward for diseased prostitutes. Designed to accommodate about 30 women at a time, almost from the moment the lying-in department became operational, the new building proved insufficient. The shortfall in space, so soon after opening, was due to new rules as required under the Destitute Persons Act 1881, which stipulated compulsory residence for unmarried mothers until their babies had reached 6 months of age. Prior to admission, each woman was required to sign an agreement. She had to agree to remain in the institution under the control of the Destitute Board until her child attained the age of 6 months, suckling the child herself. This was known as the detention clause. This requirement was aimed at increasing maternal affection so as to decrease the incidence of early infant mortality and baby farming. Mothers could only leave when their infants were less than 6 months old if they were taken either by relatives, were married women, or went to one of the refuges, who had to sign an undertaking that the conditions regarding suckling could be fulfilled as they would have been had they remained in the destitute asylum. It was easier for new mothers to leave if they were married and could return to their husbands. Women also had to agree to carry out domestic duties allotted by the matron. This was mostly laundry for themselves and the other inmates of the destitute asylum, as well as nursing and caring for their infants. They had to identify the putative father so that the board could pursue maintenance, and on leaving they had to provide details of their whereabouts to allow for follow-up home visits from the visiting officer. Some women may have been unhappy with these new rules, or the accommodation. The women were literally confined. A long-standing member of the Destitute Board described the lying-in department as being like a jail or jail yard where the girls are shut up for 6 months with no means of relaxation. Neither were they allowed any visitors, except for the clergy, the doctor, or the women's own mothers. While the great majority of women did agree to stay until their babies reached 6 months of age, and in some cases even older, a handful of women left before their confinement and had their babies elsewhere. A number absconded over the wall with their infants. For example, on the 31st of October 1881, 4 young mothers, 1 married, made off over the wall. A few mothers were asked to leave due to bad behaviour or insubordination. Many women were discharged with their infants, suggesting that they intended to keep their offspring. While some left in the care of relatives, the majority of unmarried women who left with their infants had found domestic service situations. However, the admission registers provide strong evidence that retaining work as a single mother was incompatible with caring for young children. For instance, Eilena's readmission highlights this. A 22-year-old housekeeper, her record stated she has been unable to obtain a situation with her child, and she is now admitted temporarily to wean the child that the State Children's Department may then be in a position to relieve her of its care. Louisa's case provides a poignant example of a woman trying to find work with a young infant. A 21-year-old general servant, when she left the destitute asylum with her second child for employment as a wet nurse, she was deemed not suitable and readmitted 1 week later. She remained in the destitute asylum for a further 4 months, returning to her parents when her infant was 6 months old. Her baby died 1 month later for want of breast milk. While work as a wet nurse could be viewed as a good economic outcome for a new mother, in Louisa's case, that she was selling her breast milk may have contributed to the demise of her own child. The Royal Commission on Charitable Institutions conducted in Victoria concluded that a mother who was employed as a wet nurse was effectively signing her own infant's death warrant. Once children became mobile, it was difficult for women to combine motherhood with work. That a number of women surrendered their offspring to the State Children's Department before they reached their second birthday seems to corroborate this. Among the family histories traced for this research, in all cases of women leaving the destitute asylum following the birth of a second illegitimate infant, one or other of their offspring was mandated to the care of the state around the time of the second birth. Sometimes it was the eldest child that was surrendered to state care, at others it was the youngest. The rationale for these mothers' brutal decisions was not recorded in the archival records. Nevertheless, it was likely that the potential to earn a living as an unmarried mother, which would have been compromised with a second illegitimate child to maintain, was at the heart of the decision. Marriage, either to the putative father or to another man, offered women an alternative to single motherhood. However, only a handful of women were married prior to leaving the destitute asylum. For example, Annie, aged 16, married the father of her infant in the destitute asylum chapel the day she was discharged with her infant in 1897. Her parents acted as witnesses. Florence eventually married the putative father of her daughter in 1913, 10 years after her confinement. Marriage a few years later to a man other than the putative father of their illegitimate children was the most typical outcome for women, as evidenced by the family histories that were traced. Of interest, when Selina married another man, 2 years after she had surrendered the care of her daughter, aged 7 months, she successfully petitioned the state for her daughter's return. With a male breadwinner by her side, who was willing to raise another man's child, Selina was able to provide for her firstborn. Some women chose to leave without their infants. Treated as neglected children and voluntarily surrendered to the care of the Destitute Board, later the State Children's Council, these infants were placed out with a licensed foster mother or wet nurse and occasionally informally adopted. In other cases, mothers left on their own following a stillbirth or the death of their infants. Stillbirths occurred most years between 1883 and 1918, peaking in 1884 with 10. Of the infants who died in the lying-in department, they ranged in age from 1 day to 18 months old. The most common causes of infant death were debility from birth, marasmus, and atrophy. Fortunately, deaths of mothers were extremely rare. With the opening of the lying-in department building, the extended and compulsory residence of unwed mothers in the early 1880s was hailed a success by the Destitute Board. According to the board, the encouragement of mothers to naturally suckle their infants for a 6-month period achieved benefits in terms of the health and life expectancy of the child, and for the mother, increased maternal affection and attachment. On leaving the institution, however, the women were dependent upon a range of options for survival, including baby-friendly employers, family members, and the state. And for many new mothers without a male breadwinner, maintaining the benefits achieved within the confines of the lying-in department was incompatible with life on the outside. Thank you for listening. If you have any questions or would like to follow the progress of this one-place study, please use the contact details below.